Hi everyone, this is your Nursing Mandra. Nursing Mandra website provides you information about nursing news related to licensing procedures to different countries. Study materials for different exams like DHA, HAAD, MOH and other PROMETRIC exams. Various job informations in the medical field. Free PPT presentations and notes for the nursing students as well as the lectures. DataFlow and licensing verification services to all countries. Free crash course videos for different nursing exams in Nursing Mandra YouTube channel. Current news in the nursing field. I am inviting everyone to the Nursing Mandra family. Please subscribe and join Nursing Mandra to avail more updates. Today we are going to discuss regarding gastrointestinal system questions. We will discuss today regarding hepatitis. What are the types of hepatitis? Hepatitis A, B, C, D. So, we will move through the question. Tiffany Black is diagnosed with type A hepatitis. What special precautions should the nurse take when caring for this patient? So, this is asking regarding type A hepatitis. So they are asking regarding special precautions the nurse should take care while taking care of this patient. For answering this question, you must know what is type A hepatitis and how it is spreading. The options here: A. Put on mask and gown before entering the patient's room. Option B. Wear gloves and a gown when removing the patient's bedpan. C. Prevent the droplet spread of the organism. D. Use caution when bringing food to the patient. So read carefully. These are the four options given for the question. They were asking regarding hepatitis A prevention. The answer is B. Wear gloves and a gown when removing the patient's bedpan. As you know that hepatitis A is transmitting through the fecal-oral route. So the nurse should wear gloves and a gown when removing the patient's bedpan because type A hepatitis virus occurs in the stools. It may also occur in blood and nasotracheal secretions and urine also. Type A hepatitis is not transmitted through the air by the way of droplets. So the option C, we can avoid it. Special precautions are not needed when feeding the patient, but disposable utensils should be used. So the D options, they were asking regarding feeding special precautions, that is not required. So that also we can avoid it. Okay, so but utensils should be disposable there. So to prevent the hepatitis A infection, you should wear the gloves and gown when removing the patient's bedpan. That is the answer. Next question, which of the following symptoms during the icteric phase of viral hepatitis should the nurse expect the client to inhibit? So here they are asking regarding viral hepatitis. In viral hepatitis, what are the symptoms will be there? We have pre-icteric phase, icteric phase and post-icteric phase in viral hepatitis. So icteric phase, what are the symptoms we can seen in the patients? Options: A. Watery stool, B. Yellow sclera, C. Tarry stool and D. Shortness of breath. The answer is yellow sclera, B. Liver inflammation and obstruction block the normal flow of the bile. So due to this inflammation of the liver and the obstruction in the liver, it will block the flow of the bile. So what will happen? This excess bilirubin that is turning the skin and sclero yellow, and the urine also, it will become dark and frothy urine. Okay, frothy dark urine will be there. Then the sclera will be yellowish. These are the symptoms for icteric phase. Next question. A female client with viral hepatitis A is being treated in an acute care facility. Because the client requires enteric precautions, the nurse should. They were asking for enteric precautions for hepatitis A infection. Option A. Place the client in a private room. B. Wear a mask when handling the client's bedpan. And C. Wash hands after touching the client. And D. Wear a gown when providing personal care for the client. The answer is C. Wash the hands after touching the client. So to maintain the enteric precaution, the nurse must wash the hands after touching the client or potentially contaminated articles, and after and before caring of the another client also, the nurse should wash the hand. You can remember the 5 moments of hand hygiene and washing. A private room is warranted only if the client has poor hygiene. For instance, poor hygiene means if the client is unlikely to wash the hands after touching the infective material, or is likely to share the contaminated articles with the other clients. In these cases, we have to provide the private room to the patient. For enteric precautions, the nurse need not wear a mask and must wear a gown only if soiling from fecal matter is likely. So if we are changing the bedpan or like that, if there is a chance of soiling from fecal matter, then you can wear the gown. Otherwise, to maintain the enteric precaution, you have to wash the hands after touching the client. Next question. Which of the following is not specific element of hepatitis C? So here they are asking C. Hepatitis C, not a specific element of hepatitis C. Option A. Vaccine available. Option B. May be transmitted with sexual contact. And C. Inflammation of the liver. And D. Lifetime carrier. So the answer is vaccine available. So in this hepatitis C, we can say that it will be transmitted with the sexual contact and it will cause the inflammation of the liver, and once we got the hepatitis C, it will be a lifetime carrier. So these 3 options are correct, and there is no vaccine available for hepatitis C, so that option is the not in that category it will come. Next question. An infant is brought to the healthcare clinic for 3 immunization at the same time. The nurse knows that hepatitis B, DPT and Haemophilus influenza type B immunization should. So there is 3 immunization at the same time the nurse should administer, that is hepatitis B, DPT and Haemophilus influenza type B immunizations. So what the nurse should do? Options. A. Be drawn in the same syringe and given in one injection. B. Be mixed and inject in the same site. C. Not to be mixed and the nurse must give 3 injections in 3 sites. D. Be mixed and the nurse must give the injection in 3 sites. Can be drawn in the same syringe 3 different injections? No, it is not possible. Be mixed and inject in the same site. That also not possible. We cannot mix the medications. not be mixed and the nurse must give 3 injections in 3 sites. Be mixed and the nurse must give the injection in 3 sites. So in these 2 options, which one we can avoid it, like which one we can delete it? Answer is C, not to be mixed and the nurse must give 3 injections in 3 sites. So always remember, immunization, we should not never be mixed together in a syringe. We have to take each medication separately in 3 syringes and we have to administer in 3 sites. Some manufacturers make a pre-mixed combination of immunization that is safe and effective, that medications all together coming, 3 injections together. So in that cases it is effective. But if there is separate injection, we should not mix the medications. Next question, a female client who has just been diagnosed with hepatitis A asks, how could I have gotten this disease? What is the nurse's best response? So patient is asking how she got this hepatitis A infection. So what will be the nurse's response? Options: A, you may have eaten contaminated restaurant food. Option B, you could have gotten it by using IV drugs. C, you must have received an infected blood transfusion. D, you probably got it by engaging in unprotected sex. Answer, you may have eaten contaminated restaurant food. Hepatitis A virus typically is transmitted by orophycal route, as you all know. So commonly by consuming food contaminated with infected food handlers. And the virus is not transmitted by IV route, blood transfusion or unprotected sex. Hepatitis A, it will not transmit like that. Hepatitis B can be transmitted by IV drug use, blood transfusion and all. Hepatitis C can be transmitted by unprotected sex.
Nursing Mandra provides study materials for healthcare professionals, crash course for nurses, DHA, MOH, HAAD and all other PROMETRIC exams and licensing process, DATAFLOW process, DHA license re-eligibility, MOH license renewal and more. For assistance, feel free to contact Nursing Mandra.